Well, good afternoon, everyone. Thanks for joining. I'm Frank Yiannas, Deputy Commissioner of FDA's Office of Food Policy and Response, and I'm delighted to welcome you to today's webinar on FDA's Foodborne Outbreak Response Improvement Plan that we released in December of 2021. Let me begin with the big picture view. Tackling foodborne outbreaks faster and revealing their root cause is essential to the prevention of future outbreaks. As you're going to hear today, we're working to put a plan in place to do just that. The FDA is working to enhance the speed, the effectiveness, coordination, and the communication of foodborne outbreak investigations. And we are confident that the actions outlined in the plan you'll hear today will contribute to bending the curve of foodborne illness in this country by helping to prevent future outbreaks. Think about it. Today's food system is very large, decentralized, and interdependent. Lots of different food products distributed throughout the food system. And we must adapt to ensure that the safety of these products is proper for consumers. We must use modern-day tools to meet modern-day needs when it comes to how the FDA and all of us respond to outbreaks. What hasn't changed is our commitment to protect consumers from unsafe food. That's a steadfast and wavering commitment that won't change. To prevent illness and save lives. When we unveiled the plan, we committed to holding this webinar because we recognize the importance of close communication and collaboration with all stakeholders, including partners in all levels of government, industry, academia, and consumer groups. Responding to outbreaks requires collaboration. I know we've heard this, requires collaboration, but it couldn't be truer to this topic. It includes working with our federal partners such as the Centers for Disease Control and Prevention, state and local regulatory partners, and regulated industries. Industry has a role too. And transparency is very important to FDA. We want you to know how we plan to further improve our work in this area, and that's why we're talking today. I've asked Carrie Irvin, who's the Deputy Director of the Coordinated Outbreak Response and Evaluation Network, known as CORE, to moderate today's discussion. She will introduce our FDA colleagues who are leaders in FDA's outbreak response efforts. She's also going to introduce the key author of the independent review of FDA's capacity to support, participate in, and lead multi-state outbreak investigations. And I think you're going to be pleased. Each of them will briefly summarize the key aspects of the plan, and then we're going to open the floor for questions. I hope and suspect you'll have them. And at the end of the session, I'll rejoin the group for the question and answer session. We've got a pretty large turnout. Last I heard, about 1,600 people registered, representing 44 countries around the world. So we're glad you're with us. So with that, Carrie, let's get things started. Over to you.
Yeah, thank you so much, Frank. And I can't thank you enough for this opportunity to hear from our stakeholders and get their insights, questions, and any concerns as we move forward with this plan. So we invited people registering for today's session to submit questions in advance. But again, if you would like to submit questions during this live webinar, please email them to smarterfoodsafety@fda.hhs.gov. And let me say that one more time, smarterfoodsafety@fda.hhs.gov. We would really love to get as many questions as possible, and those that we don't have time to get to today, we do hope to provide responses. So one thing I would ask is that you keep your questions focused on this outbreak response improvement plan. We will not have the opportunity to use this webinar to discuss any of our specific ongoing outbreaks or recall events. But so let's kick off and get started, and I want to introduce our first speaker. I'm delighted to introduce Dr. Craig Hedberg, who is a professor at the University of Minnesota School of Public Health and co-director of the Minnesota Integrated Food Safety Center of Excellence. He led a review of FDA's approach to outbreak response that was conducted by the university. So the review that was conducted informed the development of the outbreak plan. So just to get things kicked off, Dr. Hedberg, would you explain how you approach conducting this assessment?
Thanks, Carrie. First, I want to say that my review was not intended to be a comprehensive audit of FDA outbreak response activities. Rather, in the context of established guidelines for outbreak detection and response, I tried to assess FDA's capacity to respond to multi-state outbreaks associated with commercially distributed foods. In particular, I focused on fresh produce outbreaks because of their recent occurrence and importance. To do this review, I reviewed FDA documents and interviewed FDA staff who are primarily responsible for product tracing and root cause investigations. I also interviewed key outbreak investigation partners at CDC and state health departments who initiate most foodborne outbreak investigations, federal and state food regulatory partners, and food safety experts from industries involved in these outbreaks. Finally, I wanted to see how FDA's policies and procedures worked during actual outbreak responses and reviewed documents related to several outbreaks. Carrie?
Yeah, thank you for that, and thank you for the background of all of both the internal and external parties that contributed to the development. I appreciate that. So from that plan, and from your research, what would you say were your most significant findings?
Sure. Well, first of all, it is clear that FDA has increased its capacity and improved its outbreak response performance in recent years. It's also clear that there remain gaps and challenges to address. One of the key drivers for improving outbreak detection has been the use of whole genome sequencing, or WGS, for foodborne illness surveillance by public health agencies. This has led to increasing recognition of outbreaks associated with reoccurring, emerging, and persisting or rep strains of pathogens and food items that have been associated with them. It has also resulted in the detection of more frequent but smaller clusters of cases that likely represent outbreaks. These have increased the need for rapid traceback activities early in the investigation when exposure assessment of cases is primarily conducted by state and local health agencies. Many investigations require some source tracing of products to help identify a likely vehicle. These have not historically been part of formal FDA traceback protocols. FDA's formal traceback process involves multiple steps coordinated across different parts of the agency with inherent delays built into each step of the process. Improved traceability with electronic records should speed up tracebacks and permit a larger range of products to be traced. With the increase of fresh produce outbreaks, environmental assessments are being conducted on farms, usually after the fields are out of production. Results for an individual outbreak may not be conclusive, but are still useful when put into the context of similar outbreaks to identify common contributing factors, such as the presence of animal production on lands adjacent to produce fields, linked to the root cause of the outbreak. Finally, earlier and more open communication with industry, public health, and regulatory partners would enhance the collaborative nature of the outbreak investigations and likely produce meaningful results faster. There's a big emphasis on communication and coordination among all partners, and I think that really is critical to us.
Yeah, thank you, Dr. Hedberg, and I agree. And I think one thing that we could really read in your assessment of the report is your vast experience in working with FDA because of your experience working within the state of Minnesota. Mm-hmm. So with that, bringing that state experience into this process, can you suggest ways you think state partners can best work with FDA as it implements its improvement plan?
Sure. That's a great question, Carrie. And with respect to tracebacks, getting better information up front starts with routine interviews of cases and detailed exposure assessments by states to provide the initial information needed for source tracing. To better identify the suspected food items faster, states should look for subclusters of cases associated with the same food establishment or retail food store. This increases the likelihood of contaminated food item was obtained from that source. When possible, ingredient-specific case control studies conducted within these subclusters may well identify the contaminated food item. The sooner this happens, the better. These are some of the items that have been promoted in the C4 guidelines for foodborne outbreak response, but really haven't been fully adopted by the states. Many of the elements of root cause investigations start with good epidemiological investigations integrated with environmental assessments. State health and food regulatory agencies have a critical role in developing this information and may work alongside FDA investigators throughout the process. Tracebacks provided important epidemiological information for evaluating results of environmental assessments and may provide critical support for identifying the root cause of the outbreak. Food safety experts from industry are also critical to the success of these efforts. And states can join with FDA and CDC to disseminate the results of individual outbreak investigations to their constituents. And as part of FSMA, CDC established a network of integrated food safety centers of excellence with academic partners at state health departments to evaluate and analyze the timeliness and effectiveness of foodborne illness surveillance and outbreak response, and to disseminate and communicate information about available resources for outbreak response to local, state, and federal public health officials and other stakeholders. And COEs can help leverage FDA resources to analyze and disseminate outbreak data. And finally, working through C4, CDC, FDA, and the states can work towards disseminating best practices for outbreak response. Thank you.
Thank you so much, Dr. Hedberg. And for those of you on the line, I know that is a lot of information, but there are resources out there. And if you have any questions about what those resources are, again, please follow up with us. But so for this next portion of the webinar, I do want to touch on the 4 priority areas that are outlined in the plan. And I think you'll find that those priority areas align nicely with Dr. Hedberg's findings. So they include a focus on tech-enabled product traceback, root cause investigations, analysis and dissemination of outbreak data, and lastly, operational improvements. As tech-enabled traceability is also one of the 4 core elements of the new era of smarter food safety blueprint, and I'm presently the lead for the team for this core element, I did want to take a few moments to speak to you all about tech-enabled product traceback. So some of the key goals of this is that ultimately we need to reduce the time that is needed to identify products of public health concern. So how can we do this? Number 1 is to get better information up front. So we need to challenge ourselves with asking the right questions, educating ourselves about new technologies being used by industry to collect traceability data. So we're having the right conversations during an emergency. So in addition, we need to make sure we get off to the best possible start by exploring new ways to look at what data is available from purchases made by people that have become ill during an outbreak. Second, we want to facilitate and expedite how we receive data. We want to explore new ways to receive information from industry, states, and our federal partners that can help contribute to our outbreak or to our traceback investigation. We want to use more advanced analytics to conduct accelerated traceback. So it really is time for us to tech-enable this data. Traceback has largely been a qualitative process, but we want to quantify it, and exploring new analytical tools can help us do this. Next, we want to accelerate tracebacks and trace forwards by informing relevant partners of new ways of doing this work in a tech-enabled food traceability world. We need to share what we are learning about new methodologies and provide opportunities for input. Next, we need to harmonize, where possible, traceability work that's underway at the agency related to other FDA-regulated products. So we understand that for companies that supply or sell products regulated by multiple parts of FDA, asking for information in different ways can cause confusion. And we want to seek opportunities to parallel these requests as best as we can. And finally, we want to encourage and help stakeholders use new traceback processes in their own traceback investigations. We don't want folks to wait for an emergency to test their systems. For example, we want to encourage tracing pilots by providing helpful scenarios for folks to test their traceability systems. One example of this is the leafy green traceback pilot that was conducted. And again, it's a great example of what can be learned from conducting activities such as that. So now now joining us to discuss root cause investigations is Scott McIntyre, who is currently the Program Director of the Office of Human and Animal Foods Operations West. So Scott, I'm going to go ahead and turn it over to you to discuss root cause investigations.
Thank you, Carrie. What we want to do here is gather and share critical investigation findings and recommendations to more quickly and fully prevent future outbreaks. The plan focuses on systemizing, expediting, and sharing FDA root cause investigations. We will adopt and strengthen protocols and procedures for conducting timely root cause investigations to ensure we can conduct simultaneous investigations when necessary. We will standardize criteria and formats for producing reports on root cause investigations of outbreaks. We will expedite and release investigational findings and their implications directed at the affected industry and to the public. We will determine the most expedited process for disseminating necessary public health information and actions to prevent reoccurrence. With appropriate funds, we will seek to enhance staff and resources to manage anticipated increases in root cause analysis. So, for example, in order to adapt and strengthen protocols and procedures for conducting timely FDA root cause investigations, following an investigation, we will compare findings with previous investigation findings to identify emerging trends that can be shared with industry partners. Once we've standardized criteria and the right format for producing reports on root cause investigations of outbreaks, one of the things we will do is post an FDA model documenting for industry how to best conduct an industry root cause analysis of an outbreak. To determine the most expeditious and transparent process necessary for disseminating public health information, learn from an investigation, one of the things we'll do is benchmark with other agencies how they will disseminate action alerts that enable faster and fuller dissemination. In addition, we'll evaluate the usefulness, timeliness, and feasibility of the publishing the new outbreak investigation report within 6 weeks after the close of the investigation to expedite the release of investigation findings and implications of those findings directly with the affected industry. And lastly, we'll look into the expansion and use of FDA-supported rapid response teams to enhance coordination of and expedite investigation activities between the FDA and other relevant federal, state, tribal, territorial, and local partners to manage anticipated increases in root cause analysis. Thank you very much, and we look forward to the questions. Back to you, Carrie.
Thank you so much, Scott. And again, no small feat there. So much work to be done, and appreciate you providing that overview. So now I'm going to turn it to Dr. Stick Harris, who's currently the director of FDA's Coordinated Outbreak Response and Evaluation Network, and he's going to discuss analysis and dissemination of outbreak data. Over to you, Stick.
Thanks so much, Carrie. Good afternoon, good morning, depending on where you are. At FDA, we're always looking to more closely and quickly identify the source and provide earlier and more open communications with our government partners, industry, and the public. Within the Foodborne Outbreak Response Improvement Plan, our target goals include more fully analyze past outbreaks to understand current outbreaks. We live in a world where data is everywhere. In responding to outbreaks, CORE identifies a great deal of data and information, and it's crucial to look at these data over time within pathogen commodity pairs to identify trends across outbreaks. Are there commonalities? Do the same firms show up repeatedly? Is there seasonality? If there's no learning from our past, then we're just doomed to repeat it. Number two, facilitate greater sharing of data with CDC and our state partners. This includes not only data and information specifically on outbreaks, but also to assist in prevention. As we trend data that comes in during outbreak responses, we want to share those analyses with others to, again, assist in reducing foodborne illnesses. Number three, increased transparency of outbreak investigations. We've already started that with the CORE investigation table, an online table that lists outbreaks at various stages to which CORE is already responding. That has finished its first year and is undergoing an extensive evaluation survey of readership. But again, finding the reasons why an outbreak originally occurred is crucial. And so is relaying that information to folks who can make a difference and ensure it doesn't happen again. This includes not only our federal and state partners, but also industry and the public. And then number four, enhance efforts to work with CDC and USDA's FSIS to identify reoccurring, emerging, and persistent strains of pathogens. With the increased use of whole genome sequencing, FDA, CDC, and USDA's FSIS have identified what we call rep strains, reoccurring, emerging, and persistent strains. These are some of the bugs that concern us the most. We've been working together across the interagency to ensure that when cases of these pathogens are noticed, we move at an accelerated pace since we already know they cause outbreaks. Thank you.
Thank you so much, Dick. Really appreciate that overview. And then finally, we have Admiral David Goldman, our Chief Medical Officer in FDA's Office of Food Policy and Response, and he's here to talk about operational improvements. Admiral Goldman, over to you.
Thank you, Carrie, very much. And I'll wrap up the introductory portion of today's webinar, and then we'll get to your questions and we'll answer those questions. We wanted to talk a little bit about our efforts at operational improvements. And I want to first say that the operational improvements you see on the plan that we posted in December represent but a subset of the operational improvements that are underway at the agency. I can tell you that each of the program officers are evaluating efforts to streamline their practices to shorten the time from point A to point B, all of which we hope will make an impact on reducing foodborne illness. I want to focus a bit on a couple of the improvements just by way of example. And I want to focus first on metrics, which are being addressed across the entire foods program. They are a combination of operational metrics and public health metrics, which together we intend to translate into a faster response, earlier action, and secondary prevention, that is, preventing further illnesses during an outbreak. In addition, our continuous improvement efforts are looking to streamline where and when possible. For example, to remove steps or to do things in parallel rather than in sequence. One example is here. How can we turn around our investigation reports and root cause investigation findings so that the industry can implement the results of those findings for the next growing season? Finally, it's already been mentioned that early tracebacks can be helpful, and I want to say that the FDA already engages in early tracebacks. We have early communications with the CDC and with the states on our joint calls with states, and they provide information, the states provide information about the points of purchase or points of service that have
led to the illnesses that we're investigating, but we will continue to look for opportunities when appropriate to increase our use of early tracebacks. With that, I will turn it back to Carrie, and we will proceed with our questions and answers. Thank you, Carrie.
Thank you, Admiral Goldman. And so I'm going to ask all the speakers to go ahead and join us back on camera. Thank you. And as they do that, I want to draw your attention to, if you do have questions that you would like to submit, you can see the email address, smarterfoodsafety@fda.hhs.gov at the bottom of your screen there. So again, we encourage you to send your questions in. So why don't I go ahead and get started and get the Q&A kicked off with one on traceability, or at least a question that I'll take. And this is one that we received in a little earlier. So I'm just going to go ahead and give it a read. It's based on current media releases and activities. The FDA seems to be treating any non-zero probability event as an actionable event. When does the FDA intend to develop and disseminate a definition of scientific risk-based analysis, giving industry realistic, actionable guidance against which to operate? So again, these are such wonderful questions, and they really do give us the opportunity to talk a little bit about some of these tough issues. And I think where both the Outbreak Response Improvement Plan and New Era for Smarter Food Safety are concerned is that you've heard us mention a lot the need to bend the curve of foodborne illness. You heard this from Deputy Commissioner Yiannas at the beginning of this presentation. So in order to do this, in my opinion, we can't simply accept that illnesses, especially those associated with an outbreak, are acceptable. So any event that we respond to suspects that people became ill after consumption of a product that we regulate, and we take those situations really seriously, and we must take action. So where I think this plan will help is driving at that second part of this question, which calls on us to provide scientific and risk-based analysis on these issues. So in order to do this, we have to improve our ability to understand the causes of the outbreak. And in order to successfully do that, we have to be able to gather that information. So to be able to determine what contributed to an outbreak, we have to be able to find the source. Improvements to our traceback process will allow for this, and will allow for us to do it hopefully more frequently, to do it faster, to prevent additional illnesses, and with more accuracy and precision than before. But I think the key point here is improving our traceability will help inform and help us have those targeted root cause investigations that are needed so that we can provide scientific and risk-based analysis on these difficult issues. So is there anyone else on the panel that wanted to contribute to that? I know I touched a little bit on root cause investigations there. I just wanted to open that up.
Hey, Carrie, this is Scott McIntyre. Sure. It's very important to gather the information that's pertinent for our field force to be able to go out and respond to an outbreak and conduct that investigation and look and work with the company to see what they've actually done in relationship to that particular, those illnesses. They hopefully have been made aware of those illnesses by now, and they've actually been able to take some steps to help mitigate further risk to the public. So our investigation team would be out there to conduct an inspection, collect samples, both environmental samples, finished product samples, coordinate with the industry as far as a product that might still be on the market to determine if there's a necessity to remove it and under a voluntary recall. We also would potentially need the company to cease distribution of product because of concerns that are still been raised during an inspection. So we work closely with the industry, and we put out public notifications to help the public understand those situations so that they can protect themselves and their families, especially if it's related to recall. And we highly encourage the industry to publish as well safety alerts and recall notices, not just the FDA. And our local and state agencies coordinate with us, and we conduct joint inspections with them on these particular investigations because we feel it's important for them to be part of the team and help us understand if there's any nuances that they have that are a little different than FDA's potential. Our jurisdiction might be different. They may have more authority than the FDA in cases where we need to make sure we mitigate the risk and take appropriate action. But we really like the fact that we can collaborate with the industry to make sure that they're addressing the issues before we get there, and then work with them to make sure that what measures they put in place, corrective measures, are going to be longstanding and effective to prevent future outbreaks, illnesses. Thank you.
Yeah, thanks for that, Scott. And then just while we have you on the mic, another question for you is, why doesn't the FDA offer foodborne illness investigation training?
That's a great question. Let me answer it this way. We do offer it for FDA and state food safety inspection staff. If the question was about industries, is that is available for industry? Currently, it's not by the FDA anyway, and there's probably other sources that industry can go to, like at universities or probably some private consulting groups that might put that particular training on. But we do train our staff on traceback investigations. We have an epidemiology course for staff that would be conducting inspections based on a microbiological outbreak or contamination. And we use that, again, for our states, including the states that have their rapid response teams. It's very important for them to have that because they're going to be possibly the first responders when there is an outbreak. And we're looking to continue with the foodborne illness investigations training. The last one we did was in 2018. Our training office right now is looking at putting that on probably in fiscal year 23. Thank you.
Thanks, Scott.
Carrie?
Okay. Yes, go ahead.
I'll just add that I know that C4, that Dr. Hedberg mentioned, has had an industry work group as part of the C4 effort, and I believe it was mostly focused on recalls, but there may be some training or some guidance there about outbreak investigation as well. Maybe Craig or Stick might know.
If I could jump in, David, thank you. There are a lot of training opportunities, and the Integrated Food Safety Centers of Excellence are also very involved in providing training on food safety investigations, really from a focus of integrating epidemiology and environmental health and laboratory measures together in the context of a foodborne illness. And I know that many of us on the academic side are working closely with industry partners as well to increase their understanding of what goes into a public health investigation.
Okay, thank you all so much for that discussion on training. So now we have a question about data. How does the FDA plan to make data collection and analysis more transparent? Stick, how about I kick that one over to you?
Sure. Thanks, Carrie. Yeah, it's a delicate balance because on the one hand, you want to offer up as much of the information and analysis of what we have as possible. But on the other hand, I know we did get a question about how are you protecting the data of individual firms, farms. And so, as a regulatory agency, we are responsible for holding commercial confidential information private and not putting that out. But I think it's important to be able to trend overall and gather the overall information to try and get at both root cause and the rationale behind why these outbreaks happen.
Thanks for that, Stick. And then as it pertains to FDA operations, David, I think this would be a great question for you to take. So the epi portion of an outbreak seems to take the longest to complete. What is the agency doing to speed up this process and be able to identify the causative product faster?
Yeah, thanks, Carrie. That is an excellent question. We often ask the same question ourselves here as a regulatory agency who's given information toward the end of an epidemiologic investigation and then asked to act on that information. I will say that the development of CORE in 2011, and specifically the CORE signals team, has offered us an opportunity to get some of that epi information early on. So even before we know that it's an FDA-regulated product, we are able to have an early warning about a potential outbreak that might be related to an FDA-regulated product. So we do get information earlier. However, it's important also to say that the epi portion of an investigation is really that conducted by local health departments, state health departments, and the CDC. And it depends, from the beginning on individuals who are sick, seeking care, having a lab test done, having that lab test analyzed, and eventually go to a state health department for evaluation, and identifying a cluster of illnesses that need that epi link before we can move it along. So there's a whole front end amount of work that's done on the lab side, on the epi side, before we really can begin to take action. But it is important that we have those early discussions with CDC and state partners via the signals team, and it really allows us to be poised to act when we have actionable information. But it's a great question. Thanks.
Thank you. And then, Dr. Hedberg, I did want to put you on a spot a little bit to talk about maybe some more of the non-traditional sources of information that have recently come to light and are being talked about, with really like different ways to conduct syndromic surveillance. So I didn't know if you wanted to take the opportunity to comment on that at all.
Well, I think, Carrie, thank you. About 3/4 of foodborne outbreaks are identified through foodborne illness complaint surveillance. And this is something that is conducted on a routine basis in state and local health departments all around the country, and really forms sort of a system where people eat at a restaurant typically, or may get a food item from a grocery store, get ill, and then call local or state health department to report that illness. That has been really a key factor in being able to detect outbreaks on a local and state level. Now, there's a lot of interest in social media and internet-based platforms for conducting surveillance that way. But, I think the key elements that are really needed for effective complaint surveillance is that there's identifying information about the person who's complaining, and that information can get back to the health department so they can assess a longer food history. One of the things we see a lot is that with many of our foodborne illnesses like norovirus, we have a 36-hour incubation period. A lot of complaints are based on sort of the last thing people ate. And so there's a process we need to go through to sort the reliability of that information. And one of the things I would just express a concern about social media is that it can really amplify noise as well as amplifying signals that might be critical for outbreak detection.
Yeah, thank you so much for that perspective, especially as we, think and brainstorm about ways to sort of get in the fight sooner. Stick, this is the next question I have, I think is, I'd love your thoughts on. I know I wanted to get some thoughts too, but it's the plan seems to miss a key challenge that has become greater and greater: the ability to share information between federal, state, and local agencies with co-public health responsibilities. So ultimately, we want to detect an outbreak and mitigate the risk by ensuring product isn't available and is removed from consumers' shelves. So information sharing challenges are preventing us from effectively doing that. So some statements in there along with the question, and again, I really appreciate this question because I think we all know and all feel that information sharing is such a fundamental element of all that we do when responding to outbreaks and emergency events. So while information sharing, I think, it isn't necessarily called out specifically in its own element, I think that it's such an important part of each of these areas that considerations for information sharing have no choice but be built into each component. So I know for Traceback investigations, for instance, obviously like the use of new systems, the use of new technologies, any new information requests or procedures will need to be worked on in collaboration with our investigational partners. And of course, that includes local and state officials. So if FDA is utilizing a new system to analyze traceback information, we'll want to make sure that the states can contribute to that system and its development, and then also be able to utilize it. So those are just some of my thoughts as it pertains to traceback. Dick, is there anything that you wanted to add?
Yeah, it's certainly difficult, right? You have, federal agencies, you have 50 different states, you have a variety of different local health departments, all trying to work in concert for an outbreak that is moving and whose target is moving over time. And so including everybody is at times difficult. I think there are moments where, we are required to have anybody who is attending our calls commissioning or a 2088 agreement. And I know there are movements afoot by our Office of Partnerships to expand that and try and get more people involved, because the last thing we want to do is be cutting people out when we're trying to identify the breadth of an outbreak and how many people can be affected and its products distribution.
Thanks, Dick. And then kind of switching gears a little bit to talk more about the investigational approach. Scott, I was wondering if you could take this one. The question is, does the plan focus on getting FDA and CDC boots on the ground on farms in the U.S. and other countries when an outbreak is in its early stages of hypothesis generation so that samples can be taken, observations can be made as close in time to the food distribution and processing as possible?
Yeah, thanks. Great question. Definitely. The sooner we can get out there, the better protection we can provide our public, right? So it's very critical, as David said earlier, to get that piece of information that's critical to where, we need to make sure we're addressing the right product, the right vehicle, so we know where to target our resources. So we will focus on those products that are related to the complaints that come in from consumers, what we get from CDC in the states, and then, conduct those inspections. We do those domestically and also overseas. There do have cadres that do inspection of facilities overseas. We have a produce safety network of investigators that are specifically trained in on-farm inspections. We work closely with the Center for Food Safety and Applied Nutrition. We have staff as well to support the produce safety network. So, once we are able to identify, at least with some confidence, a product of concern, as I said earlier, we will be out there to conduct an inspection and investigation, look at the root cause. If we have information that provides better intel on what we might be looking at, needing to further investigate, we'll do that and collect the information to help educate not only ourselves on the issue, but hopefully, as I said in the plan, is to disseminate that to the industry to help make the industry to become better in these situations. Hope that helps.
Yeah, thank you, Scott. I also think something that Dick mentioned earlier that's also incorporated into the plan is this idea of rep strains. And when we've identified microbial strains from clinical samples that we've seen before, sometimes there are early pieces of information there based off of the history of that strain that maybe provide us this opportunity to get out a little sooner so that we can make those observations based off lessons learned from the past. David or Stick, I don't know if either one of you wanted to comment any further on that.
No, it's very true, Carrie. I think, and that has played out particularly in the last couple of years with WGS and being able to use that high resolution. But it also, we're still learning. It's very apparent that there are some strains that are more genetically diverse than others, and so having moving quickly is a good thing, and we need to be able to do that. But we also need to be patient to see if maybe this one is slightly different and isn't the same as the last one. Well, what does that mean in the environmental world in terms of where that bug can be coming from and how wide the contamination could be?
Thanks, Dick. So again, I think reading this plan, there are obviously a lot of questions about resources. So David, I was wondering if you could take one that asks, the question is, what plans are underway to incorporate rapid response teams in every state? And maybe you could just, at a really high level, explain what a rapid response team for those on the line that might not be familiar.
Sure. Thanks, Carrie. A good question. We've alluded to rapid response teams a couple of times already. First, let me start here. Rapid response teams are collaborations between the FDA and state, usually state departments of health, maybe state departments of agriculture in some instances because states are organized differently. But it really is an extra set of eyes and ears and arms and feet that help the state officials do any number of things. They really have an all hazards approach, but one of the things that they do, especially and in light of what we're talking about today, is assist with foodborne illness investigations. So right now, approximately half of the states have RRTs, rapid response teams, that are funded. There are a couple of states that have rapid response teams that are unfunded. They feel it's important enough that they have this extra set of resources to apply to those situations. So what we put in a plan and what we're endeavoring to do is not so much increase the numbers right now. We have a good number out there now, but rather increase the use of the rapid response teams. And I'll just give you one quick example before we move on. Rapid response teams are very nimble and able to go out into the field, and when there is an outbreak investigation underway, they can be very helpful in collecting leftover food items from a case patient's home, which can really sometimes break an outbreak investigation open and provide us information that helps us to take the appropriate action after those findings. So rapid response teams are highly valuable. We want to integrate them more and more. And I think on the tactics calls that include states and CDC, we always are encouraging the states' RRTs to be involved in that way and many others. But good question. We want to use them. Thanks.
Thanks, David. And I find it interesting because I think as we're talking about all of the partnerships that it takes to investigate these emergencies, transparency of data is discussed, how this information will be shared is discussed. And I am seeing those questions come in, and I know, Stick, you touched on this a little bit. But Stick, one question that I'm also seeing is, how will you protect trade secrets within the data?
Sure. And, the bottom line is we cannot be sharing trade secrets, right? And so by lumping the data together and looking and trending overall, you eliminate singularities of information. But I think FDA has a good job and will continue to do a good job protecting trade secret and commercial confidential information. That's one of the great things of having, lawyers on staff to help. I'm not one, and so my instant reaction is to put everything out there, and they kind of let me know what I can and I cannot put out. But I think overall, we have to move towards trending and looking at pathogen commodity pairs and outbreaks over time, with outbreaks with an S, to try and determine causal factors.
Thanks, Dick. And then before I put Frank in the hot seat, David, I have one more question for you, and I think this is an important question to ask for a point of clarity. Is the Foodborne Outbreak Response Improvement Plan only applicable to human foods, or will this also be applicable to animal feed and pet food related outbreaks? So I just think a nice clarification on that.
Yeah, thanks, Carrie. That it is important to clarify, and I think we tried to do so in the plan itself, but it is meant to cover only human food outbreaks. But having said that, there are probably elements that the Center for Veterinary Medicine would use in their own response to animal feed or animal food outbreaks. But this plan was developed specifically for responses to human food outbreaks. Thanks.
Carrie, can I also add?
Please, yes, please.
People understand that we love our animals. In fact, I think there's some on this call today on the panel that have a few four-legged critters. We take those incidents seriously when a pet is ill or has unfortunately passed. For instance, we're currently following up to deaths to canines from dog food. A company received a corporate-wide warning letter, and we're out there conducting inspections as a follow-up to that warning letter to determine, what caused those dogs' deaths. We believe it was aflatoxin, so we're expecting the company to do cause analysis and inform us what they've done to mitigate the risk so it doesn't happen again. Over 200 dogs. That's significant. So we take those seriously. Thank you.
Thanks, Scott. And thank you all for the work that you're doing out there on that. Okay, so Frank, we have gotten some questions that speak more to the plan overall. So one question that we received that really stood out, I thought we'd ask you, is if we can reliably determine who was elected President of the United States in 8 to 10 hours after the polls close, why does it take months to determine the cause of a foodborne outbreak?
Oh, wow. Very good question. First of all, I'll answer the question. Let me just thank all of the speakers today. Magnificent job, Carrie. Excellent job facilitating it. And Dr. Hedberg, thank you so much for your leadership and your report. Elections, I like to say that food safety is not political, but we'll use this as an analogy. First of all, I don't think it takes weeks necessarily or months to determine the cause of an outbreak, but I do think the question is a good question, and I noticed that the person said the cause. I didn't say the source. And we're in agreement that determining the source of an outbreak is important. We want to remove the contaminated food from the market. We want to prevent additional illnesses, but the source isn't enough. And so what you've heard today is a conversation about going beyond the source of the outbreak and the cause. And you've heard us talk about root cause investigations and going further than we've ever done to really understand why it happened in the first place. Then and only then can you inform prevention. But identifying the cause is challenging, and I'll give you a couple of reasons. If you think about this complicated, multifaceted process that you heard your Admiral Goldman describe, I want you to just come along with me, and I want to paint a mental picture, a visual picture of epicurve. You have the x-axis, which is time. Imagine that's measured in days. You have the y-axis with the number of cases. When a food product enters commerce, it will take a while for that food to actually get distributed. It might go to distribution sources, to restaurants, to homes. Take a period of days before that product is consumed. That product then will be consumed by people, and it may take a period of time before people start becoming ill, depending on how widely that food product was contaminated or consumed. So you have onsets of illnesses that might vary over that axis over time. And then as you heard Rear Admiral Goldman layout, it might take some time further for people to become ill enough to seek medical attention. By the time they go get medical treatment, for the right test to be performed, there's tests then to be reported, whole genome sequencing. So by the time FDA becomes aware, usually through CDC, of a cluster of illnesses linked to a particular food, it could be weeks later, weeks after the product entered commerce. That takes time. But I can tell you when I think about this process and where there's opportunities for improvement, there's probably opportunities for improvement at multiple steps, but there's two things that jump out to me. Always trying to solve and simplify process or eliminate steps. First is the limiting factor of how quickly we get that report, right? If we could accelerate getting a report of illness to CDC and establish those clusters sooner, that would eliminate time. The second limiting factor, I think, is traceability, the traceback, because FDA then gets a report, a signal of illnesses. We have to start asking questions of those consumers. Where did they buy the product? Then we have to start doing the traceback process, which you know very well. That takes time, records, paper records usually. So that traceback process is, to me, I call an Achilles heel. So I see those are two limiting steps. So while I think the analogy of being able to conclude a vote tally in 8 to 10 hours probably isn't the best one, because having large volumes of people vote over a defined period of time and tallying it up or adding it up, while complicated, can be done relatively quickly. This is more of a sequence of complicated factors that have to come together. But I'll tell you what is in common to that. Number one, I was thinking about when you asked the question, Carrie, the infamous hanging Chad story from Florida. Some of you remember a long time ago. I was living in Florida at the time. People said, we want our elections to be faster. We want to have more trust in them. And so improvements to the election and voting process only happened because people said we can improve the process. And so just like voting can be advanced and has been advanced, it has to be people-led. And that's what we're trying to do here. Smart men and women saying we can create better processes and accelerate the processes. And then the second thing that's happened with tallying up votes on elections is the use of data and technology. And you're hearing that same thing here today, which is we can improve and accelerate identifying the source of a contaminated food or outbreak, leveraging data and technology.
Thank you, Frank. And then I think we have time for one more question, and I think one that, given your background and experience, you can really offer a lot of insight to, is how can industry and regulators collaborate better to prevent foodborne illness?
That's a great question. And listen, I wanted to be intentional today. I didn't want to just say things that the audience has already heard repeatedly multiple times. Many of us have been at this for a long time. We've all heard food safety requires collaboration. We get that. We know that the food system is interdependent and interconnected, and no one entity can do it alone. But Carrie, to your point, what I've learned really clearly in my 3 years in federal service is that if we get better at public-private collaboration, there's a lot more we can do. Many of you have heard me say this quote, that alone we can do so little, together we can do so much. And so we've got to figure out, how does the public and private sector work together to accelerate prevention? And I thought there were two things we could do, instead of just saying, let's collaborate. Number one to me is really, we've got to work on a mutual level of trust. Trust. One of the reasons I don't think we do more together is because we just don't trust each other enough. I'm going to be candid with you. If you're in the private sector and you're listening today, I would encourage you to challenge the current paradigm of trust and how you work with regulators. I know some of you are going to get some pushback. Some of you will have to talk to legal counsel. But listen, whether you're in the private sector or in a state regulatory agency, we're all striving for the same thing, safe food for the same boss, the consumer. And so let's work with trust. And if you're a regulator, by the way, state or federal, I know we say we want to work collaboratively with the private sector, but the public sector has to do the same thing. Not everyone in the private sector is trusted necessarily. And we've got to assume that they're really in the business of trying to do the right thing. So let's both work to strive to work on a different level of mutual trust. Because when we have trust, we're going to accelerate information sharing. Data will be shared because we trust each other. Acceleration of trust then will facilitate business processes. It'll make things go faster. So trust is one area that I see from a vantage point now that we really have to work on. The second one is, when we talk about food safety collaboration, I want you to redefine it for the 21st century. You know, in the 20th century, I was around the 80s and the 90s, and we were talking about let's collaborate. And what we did was we demonstrated collaboration by getting around a table, sometimes public and private sector, private to private sector, and we usually tell stories. We verbally share best practices. We talk about best approaches. Let me tell you, that's a very old view of collaboration. I think you heard Stick talking about data. We are living in the data and digital age, the 21st century. And so collaboration, how do we further strengthen it, Carrie? I think is increasingly going to be data sharing. If we think collaboration is sitting across from the table and talking to someone, that's not a modern definition of collaboration. It will increasingly involve data sharing. And if we can develop those levels of trust, and if we can share data, we're all going to get smarter together. And all of that is ultimately good for the American consumer.
Thank you very much, Frank, for those perspectives. And unfortunately, I don't think we have time for any more questions. And I do see that there are lots of other questions. But for the ones that we were able to answer, I hope you all found those responses helpful. I know that we at FDA have definitely appreciated your thought and input, and I definitely want to thank our panel today for their time and commitment to answer these questions, and really just in general, all of the commitment to food safety that you see here today. So thank you all so much. With that, again, I know there are lots of questions that didn't get answered, so if we did not get to your question, or if you want to follow up with us, Admiral Goldman has so kindly offered to be a point person, and you can email him at, I believe we're able to put up his email address, but at david.goldman@fda.hhs.gov. So again, thank you, Rear Admiral Goldman, for being our point person on that. Also, as promised in our plan, we will continue to keep you posted on our progress. So please keep checking fda.gov for updates. That's sort of the home base for everything. And again, from all of us, thank you so much to our panel, and thank you so much to you all for joining us and to hear about our outbreak response improvement plan. Have a wonderful day.